Hi there, Dr. Hizon, here to talk about documenting for patient with dizziness. As always, please refer to your particular doctor, as this is a general course not intended to be medical treatment. Your particular situation may vary. So dizziness is a very common thing. It's one of the most common reasons for visiting their primary care medical provider. There's a false sense of spinning or motion, lightheadedness or feeling faint, unsteadiness or loss of balance, and a feeling of floating, wooziness, or heavy-headedness. On the physical exam, it's important to check blood pressure, both standing and supine, head, eyes, ears, nose, and throat exam, neck examination, neurologic examination. The testing and the workup include history, physical exam, CT scans, and MRI sometimes, not always. If any of them are abnormal on the neurologic findings, then they'll order these tests, but usually it's not a routine test that needs to be done. The treatment is over-the-counter medications. It could be rest or hydration. You can use headache or dizziness medications, and you can follow up with a provider for other treatments. The plan is usually a lifestyle modification. A lot of times they get dizziness from lack of proper hydration, so they might increase their water intake as long as they don't have kidney or heart problems. Limit their alcohol use, avoid foods high in histamines, get adequate sleep. Medications could be over-the-counter medicines such as the NSAIDs or non-steroidal anti-inflammatory drugs. They could use even headache medicines like Maxalt, Imitrex, Zomig, or others. And they could also get monitored as indicated per the treatment or the medication. A lot of times it's to go over these simple things of what's the appropriate amount of water they should be getting in, keep a headache or dizziness diary, and if the medications are prescribed, make sure you document how they should be taken. So headache symptoms or dizziness symptoms are something that you need to document, so they don't necessarily always have to have a headache with dizziness, but this would be the history of the present illness template. Is a 77-year-old female who presents today with a complaint of dizziness for 2 weeks. And then what's the onset, how's the mechanism, and you go through the usual things. Dizziness level, like how is their dizziness at rest out of 10, where 10 is being the worst dizziness they've ever had in their life, compared with the dizziness or pain level when they're doing activities. And you can talk about the specific sensations they're having, such as rotation, tipping, lightheadedness, loss of consciousness, loss of balance. Anything gives you more granular details on their actual symptoms, and on their timing and duration. Is it constant or intermittent? And are there associated symptoms such as URI or cold symptoms, accidents, falls? Are their ears ringing or tinnitus, hearing loss, vision changes, or neck pain? And then provocation, which is what makes it worse, and alleviation, what makes it better. And are there other symptoms with it? Did it start new? Is there any other neurologic symptoms such as tingling, confusion? How about past medical history of elevated blood pressure? Have they had recent procedures, traumas, falls, accidents, traumatic brain injury, or concussions? Any previous treatments so far, such as medications? Any previous workups, such as physical exams, labs, referrals? Have they seen specialists such as neurologists or ears, nose, and throat specialists? And then the past medical family social history, tobacco use, exercise, sleep, and nutrition. Constitutional is the checklist to make sure you don't miss any other problems they're having. Constitutional systems I usually like to put in as their weight change since the last visit that we saw them. Objective template would go something like this with their, if they are alert and oriented, times say 3 with person, place, and time. And then how is their overall ambulation, how's their appearance, how's their heart, head, lungs, abdomen. And then neurologic is specifically important, looking at cranial nerves, strength, sensation, reflexes, and then special tests such as the Romberg. And when in doubt, they sort of do more tests than not. So ultimately, after all of this, you come up with your assessment, and then you come up with your rationale and reason for what you're doing through your medical decision making. And this is a simple or a complex case that requires straightforward or complex decision making. And this is what you would have a chance to explain why you're doing what you're doing. These are the typical ICD-10 codes. Our codes are for symptoms. So symptom of dizziness and giddiness is R42. And then specifically, H81 is disorder of vestibular function, so inner ear. And then again, another R code, which is for symptoms, is R27 for lack of coordination if they're having dizziness and falling. In the plan and treatment, usually we start off with lifestyle modifications, try to get them back into balance where they eat well, move well, sleep well. Certain medications they might use. They might do balance exercise like this woman is doing under physical therapy. They could do formal and or home therapy. They usually have regular follow-up with their primary care medical provider. And then they may need to get specialty consultation with a neurologist or ENT specialist. So pearls and pitfalls: if they're having any symptoms, please get the correct affected side, left versus right, of the patient. Be sure to document all previous treatments. Past medical history of trauma and injuries need to be documented. Is there a family history of dizziness? Learn the various questions and physical exam tests to perform, such as the family history, the social history, the history of the present illness, and neurologic exam. And please ask your doctor if you have questions about the evaluation of a patient with dizziness. And in primary care, always know they come in for two things: whatever their symptoms is and their quality measures, which is their health care maintenance, such as did they get a colonoscopy, did they get their flu shot, did they get their mammogram. So as always, I want to thank you very much that these takeaway points are such that dizziness is a common disorder depending on the underlying disorder. It can be simple or it can be very complex. It is important to rule out any underlying conditions, illnesses or injuries. Patients are always worried, do they have some sort of intracranial mass such as a cancer? And these are the things that they're looking for. Those are rare, but they do happen. So know that your provider will be working hard to decide one way or the other. So I wish you guys well in terms of studying hard to learn the various questions to ask, such as an accurate past medical history and history of the present illness. Learn how to perform a neurologic exam to assist the provider. And as always, we thank you, because while doctors save lives, informaticians and scribes save doctors. Thank you for your help.